Hello, let's discuss venous air embolism. Venous air embolism. Venous air embolism occurs when the air embolism obstructs the venous circulation. Okay, venous circulation. Why it occurs mostly in venous circulation? Because in the veins there is relatively low hydrostatic pressure, so that's why it occurs mostly in venous circulation. And what happened that venous air embolism travels to the right ventricle through venous circulation. Okay, and in the right ventricle it does two things. It can cause right ventricular outflow tract obstruction, or it can cause or it can travel from the right ventricle to the pulmonary circulation to obstruct the pulmonary blood flow. Okay, so the pathogenesis or pathophysiology of the venous air embolism involves two things: right ventricular outflow tract obstruction and pulmonary blood flow obstruction. Okay, obstruction. Now, what will be the clinical features of the venous air embolism? So, let's talk about the clinical features. As in the venous air embolism, there is right ventricular outflow tract obstruction and the decrease in pulmonary blood flow. So it can cause sudden onset respiratory distress. Sudden onset respiratory distress. The second clinical features of venous air embolism is hypoxemia, because in the pulmonary vasculature it obstructs the pulmonary vasculature and cause ventilation perfusion mismatch, so which can lead to hypoxemia, which means decrease in partial pressure of oxygen. It can also lead to obstructive shock. Okay, and consequently it can cause cardiac arrest. So these are the clinical features: sudden onset respiratory distress, hypoxemia, obstructive shock, and cardiac arrest. Now, what causes the venous air embolism? So causes of venous air embolism. So it can be caused by the trauma or surgery, mostly the neurosurgical procedure. Okay, then it can also be caused by barotrauma, air trauma. Okay, baro mean air, so air trauma or barotrauma, like positive pressure ventilation. Okay, it can also be caused by central venous catheter manipulation. Okay, so these are the three causes of the venous air embolism: trauma or surgery, barotrauma, and central venous catheter manipulation. Now, how we will manage the management of the patient with pulmonary embolism? So when we suspect or we have the patient with pulmonary venous air embolism, then immediately we will place the patient in left lateral decubitus position. Left lateral decubitus position. Okay, why this position is important? Because it prevents the right outflow right ventricular outflow tract obstruction by trapping the venous air embolism to the lateral wall of the ventricle. Then after that we will give high flow oxygen, or in severe cases we can also give hyperbaric oxygen. Okay, hyperbaric and high flow oxygen prevents the venous air embolism, and it shrink the venous air embolism. Okay, shrink venous air embolism. So the management of venous air embolism, if we suspect the patient to have the venous air embolism, then immediately we will place the patient in left lateral decubitus position, because it will prevent the right ventricular outflow tract obstruction, and it will trap the venous air embolism in lateral wall of the right ventricle. And then we will give high flow oxygen, or in severe cases we can give the hyperbaric oxygen, because the high flow oxygen and hyperbaric oxygen will shrink the venous air embolism. Thank you.